Check, check.
Can you guys hear me back there if I just speak like this? Are you fine? Let's see.
Is this any better?
Okay.
Well, hi, my name is Ian Jacqueline. I'm just going to start things real quick. We're waiting on the big screen thing. And it just so happens I like to talk anyway. I'm a filmmaker, and I made a documentary called iCureCancer.com. Because about 15 years ago, my girlfriend cured herself of terminal cervical cancer. And using holistic methods, I wanted to make sure it wasn't a fluke. Yes? Too close? Is this working? Is this working? I got a broken mic. How's this? Okay, good. Okay, so just real quick. My story is my girlfriend, 15 years ago, cured herself of terminal cervical cancer using holistic methods. I had never heard of it. I didn't believe her at first. I thought she was a fluke. So I got on the internet and I researched and I researched and I researched, and I found a lot of people that cured themselves of cancer using holistic methods. And at the time, I was an actor. I used to be a kickboxing champion, and then I got into Hollywood and I did a lot of martial art movies. I was on Days of Our Lives for a little while. And I wasn't a big enough star to use my celebrity to get anybody to listen to me, but I did know how to run a camera and how to edit. So I made this documentary called iCureCancer.com. You can go to that website if you'd like. It has lots of amazing information on it as far as this subject goes. And that film reached a lot of people, but I didn't get an investment, and it was basically myself, a camera, my home computer, like it is kind of today. But it got a lot of information out there to people to realize that, and what I learned in the end was, I don't think anybody's ever died of cancer that was alkaline. If you get your pH level up to 7.0, 7.2, you're not going to die of cancer, which is ironic, because if you go get chemo, they're feeding you sugar, which is the first thing you cut out when you want to get alkaline. Can you hear me?
I'm agreeing with you.
Oh, you're agreeing. Hey, can I have an amen? I got an amen. Okay, so it very, very quickly, I picked up on it, which is amazing, because I'm definitely not a rocket scientist, I'm a layman. So I figured it out, pH level 7.0, detox, boosts your immune system, and your chances suddenly skyrocket. Chemo has a 3% success rate, as most of you probably know, and alternative medicines are just, you know, nobody ever wants to say exactly, but I'm a filmmaker, so I can tell you that they're 60, 70%. Sir? You can't hear me? Oh.
Could you put more treble in?
Treble? Yeah, we don't.
How about this? Is this any better?
Yes.
Okay, good. I don't like mics. Okay, real quick, so pH level, get it up to 7.2, detox. Boost your immune system. Many ways of doing that, whether it be through diet, supplements, and Webster Kerr, who's going to be speaking here later, he's got the site cancertutor.com. If you haven't been to cancertutor.com, then you haven't been to the best site on the web as far as learning how to cure cancer. And so a lot of really good stuff has been done with electromedicine, like Rife technology. You've heard of Dr. Royal Raymond Rife? So there's some new machines that they took that technology and made it even better. And Webster will be talking all about that. So basically, those are the two main things that I've come across with cancer. And the great thing about the Camelot Cancer Center, that's the best clinic I've found in America, if not the world so far today, just by my own research. Because through certain people they know, et cetera, they're able to use DMSO. Because the key to getting nutrients in your body is obviously going to be food, organic, all natural, but you're going to have to pump it into your cells, and the DMSO does that. And again, I'm not the doctor, so they'll have to explain it to you. But so you got two of the best things going for you right now. You got Webster Kerr with the cancertutor.com, and you got right here in your hometown, you got the best cancer clinic around, Camelot Cancer. So if you want to see my film, it's called iCureCancer.com. It's the same as the website. It'll tell you all the basics right there. And if you just order the DVD, think of it, don't think as you're buying it, it's a donation, because I'm a struggling artist. I barely get by month to month, like most people in the alternative world. So if you would like to see that movie, it'll bring you up to date, and it'll help fund me making part 2, which I'm doing right now. And this one is going to be called ICureCancer.com Part 2, Baby Killers. The reason why I'm using such an extensive name is because that's what's going on. I don't know if you know this, but I know how to cure cancer. A lot of people in this room probably do. Again, pH up, boom, you know. But if I have a child, and they're lucky I don't have one right now, because heads would roll. I could not get my child out of chemo, radiation, or surgery. Under 18 years old in most states, you have to get chemo, radiation, surgery. To me, that is murder, because they only have a 3% success rate with their chemos, not only in America, but in Europe too. It's a known fact. 75% of oncologists would not take their own treatment. It's a long story to get into politics of it, and I won't bother with that right now. But so if you want to help me finish this film, I'd appreciate looking for donations. You want to buy a copy of the movie, because we need to get this out there. Because more people, I think, will be interested when they realize their child's life is at stake. If their child gets brain cancer, which many do today, with all the toxins in our thing, or any kind of cancer, you have to get chemo, radiation, surgery. I'm dealing with 2 people right now, 2 families. Their children are in the hospital, and the parents are sitting there watching drip by drip by drip the chemo, and they know it's killing them. They saw them lose like 20, 30 pounds. They're down to nothing. They're dying. And they got a cop standing at the hospital door. You cannot take that, because they took the passports away from not only the parents, the grandparents. This is what's going on. Now, I have just found out there's a loophole. There's a way of getting around this, and that's why I want to get this into my film. Or at least I think. I know of people that have gotten out of it. It's all about, I think, international law or contracts law. There's ways of going sovereign, and somehow what's saying, you're basically bringing your responsibility back to yourself. Because when you're born in America, you're a part of we're not America anymore, we're a USA. It's a corporation, and you're part of that corporation. So if there's anybody in that situation with their children right now, talk to me. I don't know a lot about it yet. I'm filming as we go. So that's another topic. I guess that's about it. Did you want to, well, do we want to take a minute until or no, just keep rolling?
No, we're fine.
Okay, so thank you everybody. You're in the right hands. It's the place to be right now.
I need to explain, most conventional cancer treatment centers that you walk into, all of them have a big oil portrait of a dead patient that supposedly was the inspiration for the facility. Camelot, as far as I know, is the only one who can say that up until recently, within the past 6 months, our big portrait in the lobby was of our first longest surviving patient, very much alive and cancer-free for over 14 years after we treated him successfully. Finally passed away at age 81 from natural causes unrelated to cancer. Lazarus Long, and we have an MP3 file, an audio file of the last radio broadcast that he did when he was interviewed by Seaview Radio in Palm Beach, and here we go. Here we go.
My Boomers Health Tips guest today is Lazarus Long. Don't you love that name? He has a very diverse background of being an entrepreneur around the world and also owning a lot of restaurants, and also he's a fabulous chef. But the thing we're going to talk about today is that he was the first patient treated by Camelot Cancer Care. How many years ago was it, Lazarus?
13 years ago.
13 years ago. And you had non-Hodgkin's lymphoma. Exactly what is that?
It is a very severe kind of cancer, supposedly non-survivable by somebody my age at the time. I was 67 years old. I had some symptoms, went to a doctor. I won't go into all the details, but With a PET scan, they determined I had non-Hodgkin's lymphoma in my groin, in my clavicle, 3 places in my spine.
Oh, my.
Stage 4, very bad situation. The doctor said that I would be dead in 90 days if I didn't do chemo and radiation. So I said, well, I'm not against that altogether, but I want to talk to somebody else with this type of cancer that's been through that. It took 2 weeks of browbeating that doctor to get him to admit there were no survivors in my age group.
Good heavens.
And I said, something wrong with this picture. I'm going to be dead in 90 days if I don't do this. Yet everyone that's done it has passed on. There's something wrong with that picture.
Exactly.
So I left his office very angry. And we began looking for alternatives. Found the DMSO. And to be perfectly candid, I had no faith in it at all.
Now, what is DMSO?
DMSO is dimethyl sulfate, whatever.
Mm-hmm.
I am not very well versed in how to pronounce it, but I am very well versed in the effects.
But it's been around for a long time. I know. I've heard it being used to treat arthritis.
Yes, and in the 30s they treated cancer with it. But when they came up with the chemo and radiation, it just got lost in the shuffle. There's no money to be made with it. It can't be patented.
Ah.
But it's legal to treat bladder infection. So Camelot uses it as an alternative off-label drug to treat cancer, and it works very well.
How long did you take it?
I took it for 21 days.
And how did they give it to you?
It's intravenous, and as I said, I had no faith in it at all. My family insisted that I tried it. And after 21 days, we had another PET scan, and the cancer was completely gone every place in my body.
Totally?
Totally. In my groin, in my clavicle, in my spine, everything was clean.
That was just with 21 days of treatment IV. Did they give you anything else?
No, that was the extent of it. I had no side effects. I didn't lose my appetite. And I just, I couldn't believe it. But it was very true. And 2 years later, I had to have a TERP. You don't want to know what a TERP is. A TERP is a nasty, nasty thing.
Oh, okay.
They use, it's a man thing. But I didn't like the doctor that did it, and I didn't like the procedure. But 2 days later, he called me up and said, the lab found cancer cells in your prostate. Come in right away, we'll start chemo and radiation. I said, I don't think so. Chemo and radiation kill more people than the cancer does. So I went right back. I had my own PET scan done because I didn't trust that doctor.
Mm-hmm.
And
That's wise.
Sure enough, they had cancer cells in my prostate. So I went back to Camelot. Took another 21 days of DMSO and another PET scan 2 weeks later, and it was all clean. It was clear. So I'm a great believer in
Obviously.
the DMSO and the process and the people in Camelot, the way they treat it.
So you were the very first patient there.
I was first patient with non-Hodgkin's lymphoma.
I see. But they use this on other types of cancer.
They use it on almost every kind of cancer, and it seems to be effective on almost every kind of cancer.
Now, what is the survival rate, Lazarus?
Survival rate is much higher than anything else in the chemo radiation kind of thing. They have close to a 60% 5-year survival rate.
Good heavens.
Now, the chemo and radiation is what is called standard of care.
Mm-hmm.
Standard of care has killed more people than the cancer has because they are locked into that. They may not do anything else.
Oh, who governs that?
The AMA, FDA, whoever, and the doctors are taught in school. Yet the survival rate, 5-year survival rate, is only 2% greater using this terrible poison than it is if you do nothing.
My, that is extraordinary.
So it is very, very toxic, and that's the beauty of the DMSO that is used by Camelot, is that there's no toxicity. There is no side effects. You don't lose your hair. You don't lose your appetite. You don't get nauseous. And it is very, very effective.
Now, where is it? Do you stay in Tulsa? Tulsa, Oklahoma is the cancer care, Camelot Cancer Care.
Yes.
Yeah.
They are an outpatient clinic. Now, they have arrangements in motels and hotels for people to stay in, bed and breakfast, where they stay. And they come into the clinic for an hour and a half. or 2 hours, depending on their age and the condition, to take the drip intravenous treatment. And then they go back and take care of whatever they're doing. They have their life the rest of the time. It's just a 1.5 or 2 hour period every day for 21 days.
Oh, and their family can come with them. And
Yes.
they sightsee and they don't feel sick so that you can get other things done.
Exactly.
And then you take another, how do they know? I mean, they give you a test there at Camelot.
You get a PET scan that shows every cancer cell. This is the state of the art of identifying cancer. Then you know exactly where it is and where to look for it after it's over to see if it is all taken care of, if it's in remission.
Now, they never say you're cured. They always say you're in
they
remission.
they don't like me to say cured, but it is, they like for me to use the word remission. But if I haven't had cancer in 13 years, I'm cured.
Yes, it would appear so.
That's the way I feel about it.
I guess they have to be careful because of the FDA. Is this why?
Oh, everybody is very nervous about all the alphabet agencies. They have a lot of people that are dependent upon this chemo and radiation business. It is a huge business. Each patient is a $1.3 million income to the cancer industry.
Good heavens.
Now, in Camelot, the cost of the entire program is $10,000 to $12,000. So you can see that they guard very seriously this income stream.
I understand that. This is Joanne Flug on the Joanne Flug Show, and I'm talking with Lazarus Long, and he went to Camelot Cancer Care and is sharing his experiences there. Lazarus, now you said that after 13 years you have had no cancer. Now you are very open to helping other people that have the same type cancer that you have, or any kind of cancer. Is this true?
Yes, and I that's my hobby now. I'm an old fellow, 80 years old.
He's a young whippersnapper, trust me.
But I am glad to talk to anyone, anytime. And when people apply to Camelot for information or inquire, they send me the information, the name and the phone number and the email address, and I send an email to them explaining my experience with this and offering to talk, because when I had it, there was no one to talk to. That is a very scary thing when you have cancer and there's no one to talk to that's been through it. So that's my hobby now, and I'm on a crusade, if you will, to keep people from doing the chemo and radiation. This standard of care kills more people than the cancer does.
And you're a living example. Absolutely. Raised from the dead, not once, but twice, Lazarus. You really have lived up to your name.
Oh, yes. It's been, and I am very healthy for 80 years old, as you can see in the short time we've seen each other. But it is a wonderful thing, and I want everyone to, and they shouldn't take my word for it. You should go to CamelotCancerCare.com and read through that website, do your own investigation, and make your own decision.
That's good advice.
I'm always there if you want to talk to me about my experiences. But that's what I'm familiar with, so that's what I talk about.
Well, Lazarus, thank you so very much for joining me today. This has been very, very interesting, and I know anybody that's got questions about cancer would like to contact you. Do you have an email address that you give out, or do you prefer that they go through Camelot Cancer Care?
Well, I'd prefer they go through Camelot.
All right.
And when they inquire Camelot, and they can click on a button on their website for a second opinion. When they do that, they'll send me the information. I'll contact you or any of your family or any of your doctors. I talk to anyone and have for 10 years.
And you can do that quite well, I must
yes,
say.
I enjoy that very much.
Okay. This is Joanne Flug, and I've been having a delightful time sharing with my newfound friend, Lazarus Long, who is a cancer survivor for 13 years, having gone through his treatment of alternative care with HMSO at the Camelot Cancer Care. And this is Joanne Flug. I'll be right back with more of the Joanne Flug Show after this.
Dr. Jennings. Thank you.
Tag me up. Okay, let's see if my voice is going to carry. Can you hear me in the back? Okay, great. We're going to zip through this because we've got a bunch of exciting speakers coming behind me. So we're just going to talk about some of the botanicals that we use in cancer treatment. So, hit me. Well, maybe. There we go. The first botanical that we use is called feverfew, which is a really nice picture. You may recognize this. It's actually, I think it's how you pronounce it, Tanacetum parthenium. Pardon me? All right. So feverfew has been used as an herbal remedy for reducing fever in alternative medicine. We use it as an anti-cancer agent. It's also been used as a folk remedy for migraines. But there's a few other things about feverfew that you may not know. Excuse me. In 2005, scientists at Rochester Medical Center found that an extract of feverfew is really effective against a type of human leukemia. The feverfew extracts kill malignant stem cells and is the first agent is known to destroy myeloid leukemia at the level of the stem cells. And for those of you who like to talk about chemicals, the active ingredient is from a parthenolide. Honestly, I don't know what that means in terms of chemicals, but it's from a class of drugs called the sesquiterpene lactones. And what that does mean is that there are a lot of anti-cancer agents that we're finding that actually come from this class of extract and drug. It does show a lot of cancer-fighting ability. The next botanical is the Easter lily, or Lilium longiflorium. And the story behind that is awesome. It's very intriguing, and Dr. Weeks is going to talk about that. So I'm not going to tell you a great deal about it, other than to tell you that lily bulbs are used as a food in China, and they're also used as medicine in China. Flip it. Okay, in addition to this, researchers, again, at Rutgers University have been studying the anti-cancer properties of the lily bulb, and preliminary studies have been shown that the extracts from the lily bulb are very cytotoxic to the MLF7 breast cancer and the HL60 leukemia cells. The lily bulbs are a rich source of steroidal glycosides and steroidal saponins, and I think that's pretty much all I'm going to tell you about Easter lily, because we're going to let Dr. Weeks talk about it. Which brings us to our third botanical. Our third botanical is the jewelweed, the impatiens flora, and it's named for the jewel-like appearance that water makes when it's on its leaves. Kind of pretty. Jewelweed's been extensively studied by Drs. Lipton, Roger Lipton, and James Lipton. And one of the active ingredients in jewelweed is actually used in preparation H. It has an anti-inflammatory effect. And as you know, cancer is basically inflammation gone wild. We think that jewelweed may have its cancer-inhibiting effects by stimulating the primitive immune system and through its increased production of an Ig class called IgM. Our next botanically based cancer treatment is vitamin C. I think it stands that history's proven that Linus Pauling's a genius. We already know that. Vitamin C is absolutely, positively essential for maintaining your health, and it's a natural anti-cancer agent. It's also antibacterial, antiviral, and antifungal. And there are numerous studies showing the effectiveness of vitamin C in treating cancer. Thank you. The next one is apricots. And Laetrile has been the center of medical controversy for many, many years. People throughout history have known about the beneficial effect of the bitter fruit seeds. That would include apricots and peaches. And we know that they have known about its effect on tumors. It was used as early as 502 AD, just pretty early. One of the active components of the seed is known as amygdalin. And amygdalin is, this sounds scary, but it's not. It's a cyanide-bearing sugar compound that's known as a cyanogenic glycoside. So what happens is amygdalin is a locked cyanide compound. And so here's how it works essentially. What you have is the cancer cell grabs onto the sugar, drags it into the cell, and then when it cleaves off the sugar, it unlocks the cyanide and the benzaldehyde that's a part of it, and it has a toxic effect on the cancer cell. And it doesn't occur with normal cells. And then last but not least, evergreens. Why do I mention evergreens as a botanical agent? Well, DMSO, dimethyl sulfoxide, is derived from wood pulp, and it was first discovered in 1866 in Russia, but it wasn't until the 20th century that the therapeutic benefits were known, and that was studied extensively by Dr. Stanley Jacob at the University of Oregon Medical School, and so that is part of our treatment regimen, and I'm not going to talk much more about it because you've heard about it just a few minutes ago. Except to say, on second thought, I can't say that I do have another slide on DMSO. It is a natural, potent cancer-fighting agent just on its own. But in addition, it has this incredible quality of being an extremely effective carrier solvent. So we can combine other botanical extracts that are generally regarded as safe, and we can use them to get them into your system, and we can use them as a topical or an oral agent. You can't really use, technically, we can't really use botanicals like jewelweed and others as IV extracts, but we can put them in the DMSO as a topical formulation, and we can be pretty assured that it will get into your system. So I thought you might like to know about a few patients. I'm going to just talk to you quickly about two patients, and I didn't bring all of their PET scans or any of their lab work because I really didn't think that was going to be important. I think that just their stories are what's important. And our first patient is a 33-year-old. Well, she was 33 years old when she was first diagnosed with cancer, and she was diagnosed with an appendiceal carcinoma, stage 4. That had spread to her ovaries, to her uterus, to her colon, and it was throughout her abdomen. She underwent extensive surgery. She had a colostomy. She had a pelvic exoneration, which means they took pretty much everything out, and they followed it with traditional treatment, including radiation and chemotherapy. She came to see us at Camelot in December of 2009, and at that time she had spread to her lungs. Her cancer had reoccurred. They did their treatment, but it came back and it was now in her lungs. She was treated with 3 20-day rounds of intravenous DMSO-based formula, which included high-dose vitamin C and B17. Her post-treatment PET scan in February of 2010 showed her to be cancer-free. Her colostomy surgery was reversed, and she's able to return to a normal active life, and we know that she's still doing good, and that's 2 years later. And there's a picture of her. And our second patient is a 57-year-old Missouri farmer with a strong family history of prostate cancer. His father and brother both had died from prostate cancer, and the patient's PSA had gone up. So, of course, they were concerned. He had a prostate biopsy, which confirmed that he also had prostate cancer, and it was stage 2 with a Gleason score of 3.6. A prostatectomy, which is a total removal of the prostate, was strongly recommended just because of his family's history. The patient declined that treatment when he did further research, and he discovered that surgery could leave him impotent, incontinent, and would have a serious impact on his quality of life. He also refused the other standard treatments, including chemotherapy and radiation, because he didn't want to suffer like he had seen his father and brother go through. His wife was in a panic. She was urging him to undergo the treatment, the surgery. Our patient received 2 20-day rounds of intravenous DMSO with vitamin C and B17, and his post-treatment PET scan showed no signs of malignancy. We contacted him this month, and he remains in remission. There's a picture of him by his tractor. And so that's pretty much all I have to say. Camelot Cancer Care, and we're going to lead on with some more exciting speakers.
Dr. Weeks.
Good afternoon. Thank you for your patience and congratulations for being here. I'm going to try to keep speaking loudly, maybe too loud for the folks up front, but please wave at me in the back if you can't hear me. And Lily and the Dragon, it's on that light. Yep. And certainly the good folks in the back who will have a hard time seeing this, if there's a question and you'd like to have the PowerPoint sent to you, I'm happy to do that. I'll be saying some things which might sound controversial, and so we always try to provide references so that people can check for themselves whether what I'm saying is considered to be accurate. I want to introduce myself, I guess, briefly. So my name is Brad Weeks, and I'm a medical doctor, and I practice in the state of Washington. And I was born and raised in Massachusetts, where I trained at Dartmouth College and then did research at Massachusetts General Hospital in endocrinology and bone metabolism. And then I did my medical school training up at the University of Vermont. And then my residency in psychiatry and neurology at Dartmouth, psychoneuroimmunology. And so those are the credentials. And then I moved to the state of Washington. Is that going to go into one big one or not? Then I moved to the state of Washington because of a very interesting law, which I'll describe in some detail. Well, I'm going to tell you a story. And I'll tell you, it's a fairy tale. So once upon a time, it's called The Lily and the Dragon. The Lily and the Dragon. And it's a very impressive story, and it has something of a happy ending, but not a happy enough ending. And without the benefit really of the visual component, I have a picture of the lily, which is the Easter lily, which is a quite impressive botanical. That's the lily. So the story I want to tell is about really what you're familiar with as patients. We call it healthcare freedom. We live in America. We think there should be freedom of choice. And as our videographer was telling us, there's a lot of horror stories happening out there today. So in my experience, I learned about Mildred Trumbull. Is this a name that everybody knows? Show of hands of anybody who has heard of Mildred Trumbull. Just about 3 of us. Well, that's not an accident, because Mildred Trumbull was the lady in this city, Tulsa, Oklahoma, great job, who wrote a book called FDA, Federal Death Administration. Now, I don't know if she was intending it to be a bestseller or not. I haven't had the chance to meet her since she was subsequently put in jail where she died. But she had a great following of very courageous patients who opted for her treatments. Now, I'm going to go through a little bit about that. But first of all, to orient you, as any speaker tries to do, this is what I'm going to try to do today in about a 20-minute chunk of time. I'm going to try to celebrate and honor the courage that everyone in the room has for looking outside of the box, and the courage of the people who are trying to provide innovative, safe and effective, we call them sensible, C-E-N-T, sensible treatments. Safe, effective, and cost-effective. And then I'm going to tell you a little secret. There are 4 questions that you want to ask your oncologist before you get treatment. So that's what we'll do. And I'm starting with the Easter lily for diabetes. That's a very interesting treatment in Asia. The Easter lily, as Dr. Jennings pointed out, is a food, a nutraceutical food. It's in their diets, and it's used to control blood sugar. What does cancer love? Sugar. How many patients who have cancer are taking metformin, a sugar-lowering drug? Go look at that, because metformin, which is a safe and inexpensive medication, has been shown to potentiate chemotherapy and other treatments. So here we have a plant which lowers blood sugar. It also, as Dr. Jennings pointed out, has steroid glucosides, and the concept again is that when you take this glucoside, the cancer which selectively is a pig and will grab sugar, that cancer eats this Easter lily extract, and in the process of satisfying itself with the sugar component of this molecule, releases, like a time bomb, the arsenic or the toxic cyanide substance, which is part of this molecule. It doesn't go to regular cells because regular cells have 17 times less the ability to eat sugar compared to a regular cell. So if you give this substance into people's bloodstream, it'll go selectively to the cancer cells, which are adapted to eat sugar, and this looks like sugar to the cancer cell. When the cancer cell is a pig and grabs it, it gets a very, very serious upset stomach, which we call apoptosis or cell death. There's also antifungal activity of this Easter lily extract, and there's a big world of information there. Now, I gave a lecture in Los Angeles in the beginning of September where I had the pleasure of meeting the folks from the Camelot Cancer Center, and I was astonished at how little I knew about this work that Maureen and Dr. Jennings and Michael are doing. So I was quite impressed, and I immediately jumped into our research facilities on the internet to learn about this plant. It's a very, very powerful plant. And the formulations which are used at the clinic I'm learning more about are also quite wise and quite effective. I have not had the chance to meet any patients yet, but I've asked the people at the clinic if they would share some information about patients. I'm just going to tell you a quick story of a 72-year-old who came from Washington State to the clinic. He's 73 now, and he had non-Hodgkin's lymphoma, which is a very bad cancer. And the account that this patient gives, I'll read to you. It says, about 3 months before coming to Camelot Cancer Center, I had 5 years of chemotherapy. What does Camelot Cancer charge for patients? $12,000. I don't know how many years of cancer therapy you could get at the Fred Hutchinson for $12,000, but it's certainly not going to get you 5 years of treatment. So 5 years of treatment with not much good coming from it, the patient writes. About 3 months before I came to Camelot, I was told by the Seattle Cancer Care Alliance, these are good people in Seattle doing their best. These are researchers, a world-class organization. I work with a lot of the oncologists there, the Fred Hutchinson Clinic, and that I was told that after 5 years of treatment from them, I had 7 tumors that were still growing, and there was nothing else that they could do for me. There's no mention in this note of a refund of the 5 years, but that's because the patient didn't pay it. It was paid by the insurance company. It's a whole big piece of information to pay attention to. Soon after I scheduled the treatment at Camelot, and I took 21 days of DMSO plus other things, and then about 6 weeks later I got a call from the Seattle Cancer Care Alliance who asked me to come for a CT scan to measure the growth of the tumors. The CT scan results, are you sitting down? 4 of the tumors were gone. Not stabilized, not reduced, but gone. The rest of this note talks about how after the doctors were discussing that, none of them asked what she had done, she or he. None of them asked it. And I've seen this, and it's extraordinary. Now, again, I don't want to be critical because I have to tell you that there is something called the standard of care. If the doctor varies from the standard of care, right or wrong, he or she is guilty. It's a bit like military law, where if your superior says you were asleep at your post, civil law doesn't apply. You are not innocent unless you're proven guilty. You are guilty of sleeping in dereliction of duty unless you can prove yourself innocent. In the case of the standard of care, one person, a drunk, alcoholic, psychotic, delusional person, can say that you did something bad and you are guilty as the doctor for varying from the standard of care unless you can prove your innocence. Have compassion for your doctors who are out there doing their best, and appreciate the doctors at the Camelot Cancer Center who are willing to be courageous. So the doctors didn't ask. So this patient said, "Are you curious as to what I did?" 2 of the doctors left the room. 2 stayed and were told, and nothing came of it. But I appreciate that 50% were curious anyway. Now, how many people have heard of Mrs. Mildred Trumbull? 1 or 2, or maybe none? That's because her book ended up like this. This is a picture of a book being burned. So what was the year that this happened? 1980?
It was in the early 80s when they raided her lab. They broke her chemistry glassware. They poured that precious formula down the drain, regardless of the hundreds of patients saved by it. And they took all copies of the 10,000 copy run of Federal Death Administration, which had not already been distributed out to patients. And they had a big bonfire.
So I'll repeat that. There was a bonfire. They destroyed her lab. They destroyed her facility. They burned 10,000 books. And what I was told is that this was the early 80s, and the person reporting it said, "I thought book burning only happened in uncivilized countries and in the Middle Ages." But the reason you haven't heard about Mildred Trumbull, who was right here in Tulsa, Oklahoma, is because you were protected from that information by the FDA. They burned her books. Now, Mildred Trumbull, I then went to the FDA website to try to learn about this woman. Very little is there. But there's a gentleman named Charles Sedgwick who was the agent on this case, and he was interviewed in a book called The History of the FDA. And he says, "I had several trials in Oklahoma. A lady named Mildred Trumbull was one of the more unique. Mildred Trumbull manufactured in her kitchen a drug called liviverum, and she made it from Easter lily flowers. She would distill the flowers and put it into a vial and inject it into people, intramuscular. Well, the prosecutor won and the judge put her on probation. Then she violated her probation. And we tried her again, and the judge put her on a longer probation. And then she violated her probation a 3rd time. And so we finally put her in jail, where she spent, and then where I spent weeks and weeks in Tulsa, Oklahoma, prosecuting that case. She died, apparently 65-ish years old. She died within 10 days of being put in the jail. And her only surviving relative, a brother, didn't learn about this until her body had already been cremated. So, I'd like to know about this woman, this Mildred Trumbull. I'm a doctor who just tries to figure out what works. Can it be more helpful than harmful? Can I understand it enough to communicate it with patients? And can they be free to make a decision? So I talked to someone who knew about this case, and I sent this transcript, and the response was, the transcript barely touches on the Trumbull case. They call her a flagrant violator, which, God bless her, she was. Again, we're talking about not a couple of healthy patients because of her care, but hundreds of them in this area. They put her on probation, but she kept treating and curing patients. More probation, same thing. Finally, they put her in jail, where about 10 days later, she died under mysterious circumstances. She was about 65 years old. Her only brother didn't learn of her death until her body was already cremated. Fact is, many people alive in the Tulsa area today remember her well and were witness to the travesty. So, what was the problem? Well, they accused her of practicing medicine without a license. That means they accused her of being a doctor. I'd like to have a show of hands of everyone who's a doctor in the room. Okay? Everyone now I want to see everyone's hands go up. All right? Everyone's hands. You are all doctors. And let me tell you what it means. The doctor is a teacher, ducere, to lead or teach. But the law, let's look at the law in the state of Washington. The definition of the practice of medicine. A person is practicing medicine if he or she does one or more of the following: offers or undertakes to diagnose, cure, advise, or prescribe for any human disease, ailment, injury, infirmity, deformity, pain, or other condition, physical or mental, real or imaginary, by any means or instrumentality. Has anyone ever said to their son, you look tired, you should go to bed? Thank you, doctors. Has anyone ever put a Band-Aid on a skinned knee of a kid? Thank you, doctors. Anyone ever said to somebody, you look thirsty, you're probably dehydrated? Thank you, doctors. So, what was Mildred Trumbull doing? Now, what is a drug? The FDA, this is, funnily enough, a very hard thing to find the definition of. They claimed she was making a drug. She took lily extract and she did something to it. I mean, has anyone ever made tea, herbal tea? Is that a drug? Well, it is actually a drug, according to the law. And you're a doctor if you give it to somebody. I don't know why I spent 15 years in school when you can just be a doctor by helping out. So, the Food and Drug, the FD&C Act defines drugs in part by their intended use as articles intended for the use in the diagnosis, cure, mitigation, treatment, or prevention of disease. What's a disease? Anything, real or imaginary. Or the articles, other than food, well, can you give food intramuscularly? You know, maybe. No, I mean, nobody says you can give food intranasally. Is it a medicine if you give food intranasally? These, you know. I don't think she had a big legal defense fund, Mrs. Trumbull. And anyway, a drug is anything that's intended to affect the structure or function of the body of man or other animals. Now, the problem really is they thought she was doing harm. Well, she was doing harm. She was doing harm to local businesses, local doctors, local establishment care, but she wasn't harming the patients who voluntarily came to see her. What is harm? Now, I mentioned that I went from Boston all the way across to Washington because of this law. This was about a 25-year-old law. The Washington state law says the use of a non-traditional treatment by itself shall not constitute unprofessional conduct, provided it does not result in injury to a patient or create an unreasonable risk that a patient may be harmed. That's a good law. A lot of doctors knew that unless they were harming somebody, they would be free to do things like DMSO and such. Advise nutrition for someone who's a cancer patient. Because unless they were injuring the patient or creating an unreasonable risk of harm, the doctors in Washington state were able to do this. So far, so good. It's worth moving 4,000 miles. Until the state decided to define harm. Well, pornography, said the great Supreme Court Justice, he can't define it, but he knows it when he sees it. It's the same thing with harm. You kind of know when you're harmed, unless it's a delayed experience, like just parenthetically, since I was teased a little bit. Anyone have a cell phone? If you look at your user's manual, you're instructed never to have it turned on and closer than 5/8 of an inch to your body. So I would suggest that when you're doing this, you're actually being harmed, but you don't notice it for 10 years. But anyway, harm is defined by the Federation of State Medical Boards as economic harm. That's their first priority, economic harm, which results in monetary loss but represents no health hazard. I would think, as far as the medical doctor is concerned, that might be at the bottom of the list. You know, what's actually in the bottom of the list is direct harm, which results in inappropriate adverse patient outcome. That's almost an afterthought. But the first harm, the doctor is harming the patient when there's economic harm. Secondly, indirect harm when the doctor is delaying appropriate treatment. Again, in America, I'm thinking, who determines appropriate treatment? Should be the patient. Should be the patient's parents, really, as well, if they're underage. But you are harming the patient, says this Washington State group of bureaucrats, if you're taking money for an unproven remedy, if you're delaying appropriate care, and finally, if you actually cut off the right leg instead of the left leg, then you're harming patients. So, see, the problem is they say you can't use a non-traditional remedy unless it injures or creates an unreasonable risk of harm. So many innovative doctors show up in Washington State that they said, we need to change the rules. We, the state, will define when you're being harmed. We are experts. You, the patient, you don't have a voice in this. You're actually not qualified to know if you're being harmed. Now, I'm just going to take a quick moment and say why we got into this fiasco with all these laws. And it goes back quite a number of years, but specifically under Bill Clinton, Janet Reno understood for the first time the amount of Medicare fraud. And if you know doctors who take Medicare, and they'd be honest with you, it's very hard to make a living with the Medicare reimbursement. So there's huge amount of Medicare fraud. So the way this worked is the Attorney General of the United States said to all of her state attorney generals, go after health care fraud, meaning Medicare fraud. All the state attorney generals said, we're on it. They go to the state medical boards. We're going after health care fraud, Medicare fraud. All the state medical boards said, holy cow, they're going after Medicare fraud? What are we going to do? So what they did is they spun that on the state level to define fraud, healthcare fraud, as what is termed alternative medicine. That's the bait and switch you have to know about. They switched from defining healthcare fraud in terms of the Medicare scams to going after alternative doctors. That's a term I don't even like. I don't think there's really any alternative to good medicine. And when Dr. A gives this drug and Dr. B gives a better drug, it's not alternative. I'm not going to take any more time because I'm running over, but the Federation of State Medical Board is someone you should know about. And then there's an organization which talks about civilizing state medical boards. I'm happy to say that Mrs. Long, Maureen Long, wrote a letter on my behalf because I'm being harassed by the state board in Washington State. And she said to the Washington State Medical Board, I can tell you that the Oklahoma State Medical Board has always been very cautious of allowing its agency to be misused as a tool by allopathic physicians motivated by professional jealousy. So good for Oklahoma. Okay, now, does crime pay? All right. I just want to tell you about Dr. H. Richard Wynn, who was a University of Washington professor and the head of neurosurgery, who is a convicted felon. His crime, from 1996 to 2002, his Department of Neurological Surgery billed $90 million and received revenues of $40 million. That's from 96 to 2002. And that's actually more than my clinic billed for that period of time. So that's $40 million revenue. Now, he was convicted of Medicare fraud. He was the first doctor in the states convicted of Medicare fraud. His punishment was $500,000. Can anybody do the math on that? He did some community service, which he did actually in an Asian country, which was nice. But the happy ending is that immediately upon being found guilty of a felony, he was fired from the University of Washington, and he was hired as a tenured professor of neurosurgery and neuroscience at Mount Sinai in New York. So we're up against not just what's the best treatment for cancer, what's the best treatment for people with cancer. We're up against finding a way to enhance people's vitality on the one hand, not just kill the cancer. So they'll tell you here it's not just taking the magic potions, which are fabulous. It's changing your diet. It's drinking more water. It's alkalinizing. It's taking responsibility for your temple. But then if you can have some safe and effective, some sensible cancer remedies, that's a great bonus compared to what's out there now. So I think I should, I'm over my time, I think, but we can talk more on details a little afterwards. I do what's called corrective cancer care. I'm very thrilled to be here to learn about what's happening here because I feel like I'll be able to integrate what Michael and Maureen and everyone are doing here. I won't take any more time about that right now, and I will simply ask you which box you're thinking outside of, because you're always, and one more after that, you're always thinking outside of some box. Every time you think you're outside of the box, you've got another box you're in. And then I was going to end with, I have some case studies I won't go into now, but I was going to end with a blank slide. And I wanted the effect to be, now we're looking at a blank slide because the whole story of Mildred Trumbull has not been told. And you all live here. And if I lived here, I'd be on the phone trying to find some of her patients, some people who knew her. It's only 25, 30 years ago. And I would try to get that story out. number one, you have to be politically active because your rights to go to a place like Camelot Cancer Care will be threatened the more successful it becomes. You will be considered by your state boards in time incompetent to assess whether you are being harmed or not. So this is a empowering message to you as consumers of healthcare that you have to be active. And I would congratulate your state medical board. I'd look them up and I'd write them a letter saying, we hear that you evaluate doctors on the merits of the case and not based upon professional jealousy of being reported by peers who don't like the success. So those are the things. Now, I did want to tell you, if I was going to take more time with the lecture, I wanted to tell you that one of the things I'm excited about with the treatments here is, of course, the clinical effectiveness. And I believe that once we understand clearer that there's two types of cancer cells, and the lecture would have gone into that in some detail. Number one, there's cancer tumor cells. The tumor cell is my cancer is the size of a grapefruit. 99.9% of those cancers in the tumor, cancer cells in the tumor, are tumor cells, not stem cells. Look up cancer stem cell. Cancer stem cells are considered the only cells which can metastasize. They're considered by Dr. Max Wicha, University of Michigan Comprehensive Cancer Center, a very distinguished professor. He says chemotherapy and radiation make your cancer worse because it stimulates cancer stem cells, the only cells which can metastasize. So the take-home message for your oncologist is, number one question is, what are you going to do to help nourish me while you kill my cancer cells? Now, if you get a glassy-eyed look at that point, you're not really in the right place. People hear the story that the surgery was successful, but the patient died. You want to be nourished, and you want your immune system to be nourished while you're getting whatever cancer treatment. Number two question, what are you going to do about my cancer stem cells? Because again, conventional treatment irritates the heck out of the cancer stem cells, and they metastasize, like kicking a hornet's nest. If you get a glassy-eyed look, he's not paying attention to the real researchers in oncology today which are studying cancer stem cells. And I have the belief that the treatments here are addressing cancer stem cells as well as cancer tumor cells. The third question would be, what are you going to do to interrupt? It's a cytokine. When you kill a cancer tumor cell, cytokines swarm out like hornets. They need anti-inflammatory agents like feverfew and such to stop that that inflammation process so that the interleukins don't do their bad work. And the fourth question I think you should ask your oncologist is, do you take insurance? And if he does, you might want to consider who he's working for. Because if I'm throwing a square dance and I'm paying the fiddler, I call the tunes. And some of my patients, they say, why don't you take insurance, Dr. Weeks? And I say, because I want to work exclusively for you. And the more you look into that little tangled web about why things get done and who pays, most of my doctor patients and most of my spouses and family patients of doctors are happy to come and pay out of pocket because they know that they're being cared for differently than under the insurance rules. Thank you for your time. I'm sure I've gone over.
Very good, we're up. Okay, a little bit louder. My name is Dr. Robert Denges. I'm a naturopathic physician. I work in the Integrations Health Center here in Tulsa. I work for Dr. Jerome Block, or work with him in the clinic. And we do a lot of, you can't call it alternative really. I think that's a bad word also. It's another type of medicine. It's not completely allopathic, it's integrative. It integrates all things into the patient's health. All things meaning conventional, natural, as much as possible. If there's a way to get it natural, that's what you do. Spiritual, we try to bring that into it as well, because that's important for people's feeling of well-being. Back up for a second. So my talk is about cancer prevention. You've been hearing about how you treat it. Cancer prevention is, first of all, not giving it a place to start. And how do you do that? If it does start, you do want to kill it without killing yourself, and that's what this is all about here. First of all, I was going to define what is cancer. And cancer is in all of us. We all have it. There's abnormal cells floating around looking for a place to go. And we don't want to give it an opportunity to go someplace before our natural immune systems killed it off. So one of the things I just said was your own immune system. So it's pretty important to keep your own immunity up. And there's all kinds of ways to do that. Vitamin C we talked about. We also talked about, we haven't talked about that, but vitamin D3, very important. It's also important for ladies' health too, for their bones. Not loud enough. Okay. Let me try it a little closer. How's that? Okay. Abnormal mass of untreated cells, and this is something that wasn't mentioned, do have an infinite life. They don't die like normal cells do. Cancer is opportunistic. And then I mentioned that already, where there is biochemical, chemical, sad food, standard American diet, get it? It is medicine too. Food is our medicine. Anytime there is one of these stresses or an excess of stress, there is an opportunity for a mass to form. Next slide. In talking about parasites, now this is a real short list right here. If I had the whole list on there, it'd be about from the ceiling down to the floor. That's how much we have. And this one here is just protozoan organisms. There's all kinds of other types of organisms that can make you sick. And some of them are quite small. They don't even show up. So they're pretty hard to diagnose. So one physician I do know very well. Next slide. Well, first of all, how does a parasite get into you? Well, it can get into us from our foods. That's the easiest way for it. And look at where our foods come from. You know, they come from all over the place. South America, Philippines. Surprising that it is as cheap as it is coming from all these other places. The life cycle of the parasite comes in through the food, matures in the body, ends up in the gut after it divides and becomes infective. Gets into the gut, attaches, or anywhere in the GI tract really, and then starts its nefarious business. Next slide. Dr. Simon Yu, the gentleman I met in St. Louis, has a clinic there, doesn't take insurance, deals extensively with cancer patients. And one of his first-line therapies, the first thing he does is treat them for parasites. He does use conventional drugs to do that, plus as well as natural drugs to carry it further, similar to what Camelot does, but not the same thing. And he made his own history is that he was in the military and practiced in South America, where he ran into, from the people there, a tremendous amount of parasite damage. And that's where he became interested in parasitology and learned as much as he could about it. So as I said, that's his first-line training, or first-line therapy. What he does is treat for these parasites. It's interesting what he uses, too, to find out, okay, what kind of parasite maybe have they got, and what organ is it damaging? And he uses the biomeridian analyzer for that and tends to look for the lines of the meridians that are disturbed. And say, well, okay, based on my experience, if this, and this, and this, then I will use this particular drug, and I'll start with that therapy. he ends up curing people. He says that many incurable conditions are caused by parasites, and once he gets rid of the parasite, why the patient's condition improves markedly. Fighting parasite invaders is difficult. Perseverance matters. He has seen diagnosed cancer tumors disappear with his parasite therapy, as I mentioned before. Next slide. Not that one. Anyway, he has written a book called The Accidental Cure, and he gave it to me. It's kind of nice to read it. I'd suggest you take a look at it. I think you can get it from Amazon.com. Of course, you all know about Killing Cancer, Not People by Robert Wright, who's here to speak after me. And he's our featured speaker, of course. I'd like to talk a little bit about breast cancer. It's every woman's fear, I think. And here, prevention, there is something you can do that is quite preventative for it. What is the main cause of breast cancer? And you look at some of the your family history. Look at your family history and see if there's a prevalence of it. And in your own mind, kind of determine whether you have a higher risk for it than the general, well, for somebody who doesn't have it in the family. Risk increases with age as we build more adipose fat around our middles, which we don't like, but it's there. The estrogen ratios shift between estradiol and estriol, and estrone, which is a third one. And abnormal estrogens from this abdominal fat end up increasing our risk to the cancers, not only breast cancer, but other cancers as well. So they say, well, weight loss doesn't have anything to do with avoiding cancer, but it does, because that adipose fat is dangerous. Particularly as you get older, your progesterone levels drop. Ladies, your estrogen levels drop, as you know, and men, your testosterone levels drop. It's interesting to me as a side how, and I don't know the answer to it, although I've read some studies on it, as to why testosterone isn't used as a cancer therapy for those who have prostate cancer. They say, well, it's going to make the cancer worse. But it was curious to me that if that is the case, why doesn't every 17-year-old boy have prostate cancer? It just didn't quite compute, you see, in my brain. And I'll have to admit, my background before I became very interested in medicine is I'm an electrical engineer. So I like to see numbers. I like to see causation, not just correlation. I want to see causation. And then, anyway, I got into medicine because I was designing medical instrumentation, and I became more and more interested in why am I doing this? What's it used for? And followed it more and more. Now I practice with a physician. How about that? Breast cancer prevention. Well, you can't change your family history. That is as it is. You can lose some adipose fat, and that's a good thing, and I think you all want to do that. But it's pretty tough to do it as you get older. And that's one of the reasons is because your estrogen levels are changed, ladies, and that's why it's tough to do. For men, I think beer is your worst enemy. Did you know that in Germany, the brewmasters, when they handle hops, must wear gloves? The reason is because they develop what's called gynecomastia, or breast. They develop female breasts, or start to, from handling the hops. Beer has hops. And so beer, being somewhat estrogenic, is what's going to put on this adipose fat. And it is true that men can get breast cancer too. It does happen. It's pretty rare, but it does happen. consider bioidentical hormone replacement as we get older. Now, we do that quite a bit in our clinic. In fact, we're pretty well known for it. And if you've listened to Doc Block's radio program on Sunday, I think it's 1170 at 9 a.m., that he talks about BHRT, or bioidentical hormone replacement therapy, quite a bit. We have helped so many people with that, and that their brain fog goes away. Sometimes migraines will go away, insomnia goes away. So many things that are nuisances, in a sense. Or maybe for some, it just threatens their quality of life completely, depending on how severe it is. This stuff goes away. Okay, how are you going to evaluate where your hormones are as you get older? Well, there's a little bit of controversy whether it should be serum, in other words, blood, what the levels of testosterone and estrogen are in the blood. Or, by the way, I just had a thought about men and prostate cancer. It's really dihydrotestosterone that aggravates the cancer. It's a different version of testosterone. But unfortunately, the prostate receptors have a preference for dihydrotestosterone, the bad kind. So as our testosterone goes down, guys, why we get a prevalence of absorption of the DHT, dihydrotestosterone, which aggravates the prostate, causing benign prostate, what's the correct word? Hypertrophy?
Yes.
I think that's the right word. And is an aggravator for prostate cancer. So for guys, bioidentical hormone replacement really does make sense. It's protective against prostate cancer, and a nice side effect is you're able to build muscle again. That's what testosterone does. So we give testosterone to both men and ladies. Okay, back on ladies. For breast cancer prevention, you're all used to getting mammograms, and your physician tells you to do this all the time. Get yourself exposed to x-rays every year, and so they can see if there's anything unusual there. I'm going to suggest another way to do that, and that is with a breast ultrasound, where if you do have a fibroid, we can see if it's vascularized or not, if there's blood vessels going into it. If there are, then it has a greater propensity to grow. If there isn't, it's likely to stay the same. Another thing that we do there, it's kind of unusual, we have a device to be able to do what's called a breast pap. It tries to pull out a little bit of fluid out of the breast. And if it's successful in doing that, then there's a higher risk, and we tend to look further. Okay, what else can you do? Plan to reduce exposure to toxins. Any kind of toxin is going to make the wrong kind of estrogen. You've heard about that, where pesticides, some of the sugars that you all eat, trans fats, anything like that that's unusual can be estrogenic. Beer, again. I'm anti-beer. And what else can ladies do to help them with reduce their exposure to breast cancer is iodine. The mammaries and the salivary glands, both, and the thyroid, all three of them, take up from the serum, from the blood, anywhere from 10 to 40 times the amount that you have in the blood and store it in those glands. Now, why would the mammary glands absorb iodine? I think the reason is because iodine is very important for fetal development and for nourishing a young child. I remember one of the conferences I went to, it was actually a trade show. I tested about 200 people for iodine sufficiency. And I'd say about 95% were insufficient. The only ones I found sufficient are those who ate quite a bit of seafood and sea vegetables. Sea vegetables concentrate the iodine from the ocean. So, but I did see one lady who came by, and she happened to be an MD, which kind of surprised me, and that she was taking 50 milligrams a day of iodine, actually Lugol's formula in the form of iodoral, while she was breastfeeding. And I kind of raised my eyebrows. I thought that's a little unusual, but she said to me, she said, "I want my baby to be smart." Now, I'm not recommending that you do that. Far be it from me as a naturopathic guy to say you do that. But it was interesting to me that an MD would do this. Then you supplement as necessary with your trace minerals. You all know about that: selenium, zinc, copper, magnesium. Magnesium's important, particularly for those who have any kind of GI problems. Magnesium is quite helpful. And it seems like so many people are deficient in magnesium anyway. If you did a micronutrient test, which we do, we look at levels of the trace metals and minerals, and we see that quite a few are low in magnesium. Okay, next slide. I already talked about BHRT. Does BHRT require a prescription? Yes, although it's turning out that there may be other ways to get around that. One of the reasons that BHRT is a prescriptive is because there are severe restrictions on testosterone cyprinate, which is what we use for both men and women. Testosterone is classified as a class 2 restricted drug, which means from what I've been able to learn so far about that, you can't ship it across state lines unless you're an MD. You cannot even get it well, it has to be prescribed. You can't get it as a naturopath. Mainly because of athletic doping. That's why they refuse to do it. Is regular testing of hormone levels important? Yes, it is. Particularly if you're on BHRT, you need to test yourselves, get tested. Initially, of course, before the therapy starts. And then what we usually do is after about 3-4 weeks, we'll test again to see where you are. And then after that, about 6 months maximum, assuming that we found the right levels to where your levels come up to what we expect to see. Let's put it that way. Now, what we expect to see are not what conventional medicine typically sees or what your blood lab's limits are. And I think I mentioned too, there is some dispute between saliva testing and blood testing of hormones, but I think either is appropriate once baselines are established and you're looking for changes. But again, as we tell a lot of patients, we do not test to the numbers or treat to the numbers, rather, we treat to how the patient feels. And that's very important. Okay. Let's talk about thyroid a little bit. What does your thyroid do? It controls your metabolism, how warm you are. Your body does create heat, it has to. And what are some of the symptoms if your thyroid is not doing what it's supposed to do? That is, putting out the proper amount of T3 and T4. You're cold, maybe cold all the time. Somebody else feels you and say, "Oh, you're cold." Or in the summertime, you've got a sweater on. I've seen that. Dry skin, fatigue, female reproductive problems, can't get pregnant, hair loss. Working with a lady right now trying to stem her loss of hair. And she was told her thyroid levels were quite adequate. And I looked at where she was. She's up towards the upper range, but she was in the range. The thing of it is, the range, now being an engineering guy, doesn't make any sense to me. Because nowhere in that range can it be, if you're at the extremes, can you be optimal? What is the range? It's like 0.45. This is TSH now that tells the thyroid what to do. 0.45 to 5. That's a huge range. It's 10 to 1. So if you're up around 4.5, they say, oh, you're normal, nothing wrong with you. It's got to be in your head, right? All these symptoms that you're experiencing. Well, it turns out that we found out that most people are optimal right around 1 to 2. We get them around 1 to 2, and by the way, we do use a natural thyroid. It's a desiccated animal thyroid that produces both T3 and T4. Whereas something like levothyroxine, which is, or Synthroid as you might know it, is T4 only, and it's relying on your other organs to do the conversion and to make T3, which is what your cells use. Your cells use the T3 only. What can iodine do for you there? Well, what is T3 and T4, which controls your metabolism? T4 is 4 atoms of iodine. T3, which all the cell receptors want, is 3 atoms of iodine. Iodine does get inside the cell, into the cytoplasm. It does get into the nucleus. And it does work in the transcription of a protein that comes back out of the nucleus to regulate your metabolism. That's how it works. Now, TSH, I'd like to educate you a little bit on TSH, because you see that on your blood test. That's thyroid stimulating hormone. It comes from the pituitary, and it's telling your thyroid gland what to do. When that number is high, it means it's trying to stimulate it. It's trying to kick it, to get it going, tell it what to do. Produce more. By the way, ladies, FSH, or follicle stimulating hormone, behaves the same way with estrogen. It's a negative feedback system, as they say in the engineering world. Or put more simply, as the control goes up, it's trying to get the output to go up. Control goes down, TSH of 0, it means the thyroid's producing plenty. Shut it off. We don't want any more. In fact, you can go the other way, where you have Graves' disease or hyperthyroidism. By the way, iodine can help with that at all. It doesn't cause it. So you must have your iodine for metabolism. Iodine is useful certainly for that. Beginning to sound like this whole lecture is about iodine. It is protective against breast cancer. Some think it's protective against prostate cancer, but I haven't found any literature to support that. So that's an open question. Next slide. So in summary, how do we protect ourselves? How do we keep this thing at bay? We got the cells in us, as I said earlier. We want to make sure they don't find an opportunistic place to go. Remove the toxins. That's maybe not as easy as you might think, because the vegetables you get from overseas, not only the parasites, but they may have pesticides on them as well. So wash your vegetables. Wash your lettuce. Reduce sugar intake. Insulin stress is really, really a big cause of disease. Not only diabetes, type 2 or insulin resistance, but some people think that Alzheimer's is type 3 diabetes caused by excessive insulin production. I don't know that that's true. High fructose corn syrup. It has an imbalance between the omega-3s and 6s. Omega-6s are inflammatory, can be in excess. I'd encourage you to find out what your iodine levels are and supplement with iodine. I feel pretty strongly about that, in that some patients have come to me, and ladies who their fibroid breast cysts have been completely resolved with just the use of iodine. Reduce exposure to toxins and radiation. That is, cut down the number of x-rays if you can. Detox, considering detox maybe 4 times a year, however you want to do it. Consider hormone testing, particularly if you're over 40. Look at these levels and consider BHRT. Increase your immunity, vitamin D3. Consider a parasite cleanse for prevention, maybe once, twice a year. Look into it. Garlic and cloves, one way to do it. Consider alkaline water for prevention. You all heard about Kangen water. And learn more from Robert Wright's publications and his next talk. Thank you very much.